let's get started with what's your name, your job title, and yeah.
My name is Bill Boyce, and I'm a registered nurse for Wood River Palliative Care and Hospice.
This is Anthony Freer. I'm doing my interview with Bill. First question: what made you interested in healthcare?
When?
What made
Oh,
you interested in healthcare?
what makes me interested in healthcare? I think there's a lot of satisfaction in helping people in need and when they're in a vulnerable place in their life.
Okay. Why did you choose this career?
Kind of for the same reason, like, being able to help folks at vulnerable times in their lives when they need help, and to be able to service others. And it's also rewarding in the sense that I think the education gives you a broad aspect of the human body, the physiology. It's very broad with mental health, physical health, anatomy, physiology, cellular level type stuff. So it's just kind of encompasses a well-rounded aspect of just humans. Yeah.
What do you do in your day-to-day life?
Pardon me?
What do you do in your day-to-day life in your job?
What do I do in a day? Well, I see patients at end of life or beginning of end of life in a transition of their life, assess the needs of the patient, and I develop a care plan to help patients feel the most comfortable they can at that moment in time.
What's your greatest accomplishment?
I think career-wise, basically, I think just completing nursing school, which is pretty difficult. It can be.
I've heard. I mean,
Yeah.
I'm thinking of doing nursing, but I don't know yet. I don't know. I know there's a lot of careers in healthcare, but I don't know yet.
Yeah, you'll figure it out. You got time, which is a nice thing. You don't have to figure it out today or next week or next year. You got some time.
What was your most proud moment, like during your job or like while in your job?
I think in general, it's to see satisfaction on other people's, to see the satisfaction and relief of pain for other people. It's just that, it turns into a satisfaction for me to see other people satisfied.
Um, did you ever wish you did something else?
No,
No. Okay. Sorry.
no, don't be.
Do you have any regrets in your career?
No. Well, maybe starting earlier. I was a paramedic, worked in surgery as an anesthesia technician. Then I went to nursing school, so I went a little bit later. I wish I would have went earlier.
How's being an anesthesia technician? Because I like anesthesia. Like it's a career I want to
Well, you're in surgery, right? And to me, it's a good starting point. There's limited growth in there. You can only go so far. So that's where nursing came in, where you can. It's a broader aspect. You have more opportunities. Nursing career, there's just vast. I mean, you can go to any state. You can you go to any town, and you'll be able to find some kind of employment that satisfies you, whether it's wound care, geriatrics, surgery, hospice.
You just told me about that. Like I think it's called travel nursing, right?
Mm-hmm.
Yeah. Like I've heard about it. Like it'd be cool to pursue that as a career. Like because I like seeing new towns. Like spreading your wings a little. and seeing like new areas that you've never seen before, and see like how they do it there. I
We
guess.
have a travel nurse right now with us right now, David, and he's been doing it for pretty long time. And the people that do it love it, and they go all over the country. So that's another really advantage of putting your time in to get an RN degree. You'll definitely broaden your horizons. Yeah.
What was the last stressful like patient you had?
Um, they're all stressful because there's an expectation that I put on myself to make sure that I deliver a sense of well-being for these people. So in a way, it all brings on a sense of expectation. And if there's expectations, there's a certain amount of stress to that because you want to meet your own goals, or you want to meet your own expectation of making sure somebody is taken care of in the proper way.
How do you feel about the job?
How do I feel about it?
Yeah.
Well, I wouldn't do anything else, so I'm happy what I'm doing, content, and I can't think of another job that would provide that sense of, for me at least, that sense of contentment. Because it provides enough money, but I'm not a money-oriented person, so yeah.
How do you feel about the responsibilities that come with the job?
Well, that goes back to the expectations of myself and making sure that I deliver quality service to somebody that ties in with that. I think responsibility, but and also I think that having that high level of responsibility is meaningful, and it also gives yourself a sense of opportunity to keep yourself educated, to check the responsibility to ensure that that's pretty deep. I could go pretty deep on that, so that's why I'm pausing. It's carrying the weight for other people. I'm willing to do it. That's a responsibility. So I'll carry the weight for them. Yeah.
Okay. Sorry, these next few questions are totally optional, so you don't have to answer them if you don't want to. How do you feel about telling like families or patients bad news?
Well, it's part of what you do, and I think if you're having conversations that are meaningful, and I think if you're genuine and sincere in your conversation, it's I'd rather have them hear news from somebody that is sincere and genuine, and thoughtful in how they speak to the patients or families. So I don't mind that. I'd rather it be me than somebody else.
How do you prepare to meet patients and like in general get to know them a little bit more?
I think just be yourself and be sincere and genuine. Again, it goes back to it. I approach people as a human being. They're not patients to me. They're human beings, and I treat them with respect and understand that everyone's different, and finding out you're meeting people where they're at. So as a nurse, I go in as I'm going to meet you where you're at. It's not I'm going to let you dictate how I interact with you. So yeah.
Is there a career or like a person you look up to in this career, or in general like a person or something?
they're not in this career. I take it from I take the guidance from more spirituality than people that are directly involved in the medical field. So following more of a spiritual based, Buddhism, Hinduism, all religions give you something, and you deliver that to, and that's how you express and deliver that service with compassion. So if you've got compassion, then things will flow from there.
What is your favorite part about the job?
The favorite part is probably seeing families have gratitude and being thankful and knowing that you've made an impact on their life, a positive impact through difficult times. So I think that is one of the aspects I think it gives me satisfaction. And so
sorry.
No, don't. That's okay.
What are your goals?
Career-wise?
Career or as a person, anything.
Goals. I think to continue to just get better at what I'm doing. I mean, in human condition and the human physiology is so complex that there's just, so much to learn and know and understand, and every situation is different. So I think feeling confident in continuing my own personal education, which is just reading or, manuals of, or the newest research or evidence-based research, just keeping up with the new medical practices and new disease processes, and so I think that's the goal, just to be relevant.
Is there any careers that you would like to pursue, like while you're in nursing? Because I know there's multiple, like MP, CRNA. I know is one of them.
PA.
Yeah.
I thought about it. I think what I'm doing right now, I have more autonomy. It's also more schooling, which I don't. It's also, for me, it's debt. So, there's a happy medium. I'd like to pursue that deeper, but I'm content with my knowledge now, and just as content as the ability to give people a service that I think is challenging. So not really. I mean, I really don't aspire to be anything but an RN. I think it's really a nice balance of responsibility, autonomy, and the ability to connect with patients. Because I get to be more bedside. I get to connect more with people. I don't do 20-minute visits and out the door. My style is more of, I'd rather be involved in the person's life a little bit more. So I think being a registered nurse allows you to get, in my opinion, a better connection with people.
Do you ever wish for more?
No.
Do you wish you could do more in your job, or you
No.
wish you could know more?
No.
Content.
No.
What's the biggest challenge for you?
Biggest challenge would be when there's an expectation from family, and I might not have the answer right then and there. I mean, that can bring stress because you want to solve a problem immediately. Sometimes you can't. Sometimes you got to pause and do a little research or talk to some other colleagues or talk to a physician, or you got to reach out to make sure you're making the right decision. You know, that you are coming with answers that are safe and that are correct.
A lot of responsibility.
It is, yeah, it can be. Yeah, it can be.
How do you feel about needles? You really laughed about this one.
About needles?
About needles.
Yeah.
No scare you?
Not at all. No.
What education did you go through to get where you are today?
Well, I started off as I went through, became a paramedic in Milwaukee, Wisconsin. Then I went and became an anesthesia technician. Then I went to University of Milwaukee for undergraduate, and then I went to a community school in Wisconsin for my RN.
Would you recommend doing community school first and then like a 4-year university, or would you rather do a 4-year university to like get more to be more connected with people and like have more opportunities
For
like nursing?
Yeah.
'Cause that's like
You know, there's benefits to each way, any route. You know, there's negatives and positives with anything, but in particularly with nursing school, I think if anything's important, it's important to go to a school, regardless of where that is, that's has a good program. I would do research and find out what programs are reputable, and that's what I did in Wisconsin. I actually called the local hospitals and find out where they would hire the graduates from. Like, where do you guys prefer to hire? And they told me, and that's the school I went to. So
I had to do that now. Yeah, it's because like I got 2 years till I graduate. So I'm a sophomore, and I'm already thinking about college. I'm like, because Julie told me like go to community college, but I'm like, if I go to community college, I don't know if I'm have as many opportunities as others. I'm like, I don't know yet.
there's advantages and disadvantages to any of the choices that you make, and there's no wrong decision. That's the thing. Any decision that you make is going to be the right one. So take that pressure off, right? There's also, if you really wanted to get, the smart way to do it would be to actually like join the National Guard or join the Air Force, because they'll pay for your schooling. Then it becomes unlimited of what education you want.
I'm in HOSA right now, and I already got reached out by the Navy.
Yeah.
For medical students. It's like they're asking if I want to go to college for free, they'll pay for it, and then like a 2-year service requirement.
If if one of these questions you ask, if you do something different, that's probably what I would do. I would step back and I would join a service, particularly and specifically for education, because it's unlimited of where you could go to NP, RN, MD, whatever you want to do.
My original plan was like, you get a bunch of that, like just get either take out loans, as many scholarships as you can while doing nursing, and then after nursing probably join the Navy, and then after those 2 years in the Navy, I think you can apply for a scholarship to do like higher education.
Mm-hmm.
And like one of those higher educations I could either like choose which career I wanted to pursue, and that's how I would pay for it. I don't know though, because I know there's like a lot of healthcare careers, like I've mentioned before, and I'm still not sure. There are 2 years to figure it out.
If my advice would be, if you can, living particularly in this valley, and just in the country now, things aren't. It's expensive to live. You want to, if you want to have a family, going in with $100,000 of debt, and you can do that in nursing school now. I mean, that's how expensive schools are these days. Especially 4-year, you can come out with, $150,000 of debt. That's not a way to start. Like, like, okay, now I'm going to start, my career, and I'm already 100 and whatever, or 60,000 in, um, it's a hard way to get footing, you know. Um, so if there's a path you can take that will basically get you what you need without carrying debt. I still carry debt from my nursing degree.
How many years since you graduated?
I've been graduated for 15 years.
And how much? Dang.
Yeah. No, it's no joke.
How much debt did you accrue, if you don't mind me asking?
How much did it cost me?
Yeah, if you don't mind me asking.
Yeah, no, I'm fine. And it was close. It's about $50,000. This is 15 years ago, though.
Dang. I haven't really thought about that too much.
Yeah, and so I'm sure things are more expensive now. College is a business. They're not interested in educating people for the betterment of the community. They want some money.
Last one. What advice do you wish? What advice to those? Sorry. What is your advice to those who wish to be in your position?
I think that you do it for the right reason. Like if you're doing a career like this because you sincerely want to help people and you're compassionate about others, and then you'll do well. You'll succeed. So that's my advice. Do it for the right reasons. Yeah, whatever medical, whatever level you go to, doesn't matter.
Would you have preferred to be like a doctor or something?
Like I said, I really enjoy. Doctors treat diagnoses. I like to think that I go into a home and I'm treating the people holistically. I'm involved in their life, their family, giving advice, nutrition, sleeping, the dynamics in the home. So I get a little bit more involved in treating the people versus treating a disease process, if that makes sense. So
you like being more involved in like being with the patient.
Exactly. Yeah.
Than rather like diagnosing them and just
Yeah. I think that's just me though. Like I like to be bedside, or I like to be in the homes. I like to be involved with this. I feel I can have a bigger impact on folks when I'm really more intimately involved with them, rather than just prescribing a medication or giving 20 minutes of advice in the office, or so I think for me it's more rewarding. Again, I don't care about the money. I mean, it's not going to make me any more content if I was making $600,000 a year. I don't feel like I would change my life as far as if I'm content or not. So
yeah, because I don't know, like she's been telling me, go into nursing, go do something medical, because like I always wanted something medical career. She inspired me. My mom inspired me too, Daisy, and like I want to go to medical, but I'm just not sure what career to pursue. Like anesthesia has been something that's been interesting to me.
It's pretty cool. Yeah. That's big responsibility though.
I understand.
I mean, that's even more responsibility. They have the highest insurance premiums because
I've seen
you're putting people under, and plus it's an MD. There are some schools in the South that you can function as an anesthesia nurse.
Yeah, the CRNA that I interviewed said like that some models here in the hospitals they practice either individually as CRNA or they practice with like as a CNA assistant. I mean not CNA, sorry.
CRNA.
Yeah, CRNA assistant. They're assistants to anesthesiologists, or they serve as an assistant, or they sometimes practice. So like here in Haley, I don't think there's that many anesthesiologists here. I think they come.
I don't think so.
Yeah, what I remember what David was telling me is that they come from Boise. Sometimes if it's critical, they fly them to Boise, and the CRNAs are like the ones that practice in rural areas.
Yeah. I don't think I'd like, I mean, when you're in those kind of positions, hospitals as being a managed care, they'll work you like a dog, you know, like they'll work you nights, days, weekends. I mean, it's pretty intense, and there's got to be a life-work balance. I'm not so sure you would find that balance with work and life, but everybody's different.
Yeah.
That's important to me. Not being money and work might be important to somebody else, right? It's just not me.
It's not important to me that much. Just like helping someone behind the scenes, but like I don't want to really be recognized that much for it. I don't know. Like I don't want to be in the spotlight trying to help people that often. I'd rather be like behind the scenes, I guess.
Yeah.
If you understand.
Yeah, I mean, you'll make enough money as an RN to get through life with contentment. Like you ain't gonna be rich, but you ain't gonna be poor. You'll be just fine. And you can actually, if you work hard, you can make a lot of money as an RN. I know plenty of people, my friends, that make well over 6 figures as an RN. So, just depends on how far you want to go.
I'm ready with the questions. Do you have like any questions for me, or any questions for the project I'm doing?
Yeah. So you're obviously thinking about the medical field. Why did you choose the medical field?
I guess my mom and my aunt have been like really big inspirations for me. Like just helping, and then helping, like them telling me that they've been helping people and like how they're helping them and how they feel afterwards about it. And also like no other careers have really been that interesting to me, like engineering. It's just a lot of math.
Yeah.
And nursing and like the medical. I know there's a lot of math, but
there's a fair amount. There's not a lot. It's a fair amount, but not a lot.
Yeah, it's just interesting, and being able to help people is something that I like to guess.
I think those are good questions. What do you want out of life? And then go from there. And I think if your questions to yourself are, what's going to make me happy and content, well, I think that we all see that money doesn't do that, because it just doesn't. There's a certain amount that you need in order to maintain a healthy lifestyle, right? But there's also an amount that's just excessive that you don't need. It's not going to get you any more happiness, So nursing will put you in that category of, if you live the right life, you're not going to need any more.
Puts you like right in the middle, right?
Pardon?
It puts you like right in the middle, like.
It does, but I think you can get that work-life balance though, and to me, life's about finding contentment, right? Because if you're not content, then you're in a state of,
Like always wanting more.
Yeah, you can't want and be content at the same time, right? You just can't. So, what does contentment look like? And as a job, as a career, will that fulfill that question? Will this provide some sort of contentment? And I think it checks a lot of the boxes. Availabilities for jobs, your ability to travel, you make enough money, you're helping people. I mean, come on, you check. I don't know how many.
It's really versatile.
Yeah. And you can expand. You can go to different places as far as that career choice in nursing. You're just not locked into surgery like in anesthesia. Like, you work in anesthesia, you're in surgery. That's it.
All the time. Yeah, like I think this year I know something like what you're saying. Yeah, he's locked in surgery all the time, but there's like nurses, because they're still considered as nurses, just specialized ones.
Mm-hmm.
They still have the opportunities like travel nursing and all those things.
Yeah, you can travel. I think, yeah, you definitely can travel with CRNA. Yeah.
Any other questions or?
No.
Oh, yes, yeah. I'd like to take a photo with you so I can put on my project on one of the sketches on my project.
Yeah.
If that's okay with you.
Yeah.